Everyone, welcome to Alacrity Explains Anatomy. Today we are going to be looking at cranial foramina. So by the end of this video, you should be able to identify the major cranial foraminas, their location within the cranial fossas, and the important nerves and vessels that transverse through this cranial foramina. So as a way of introduction, the skull is not a solid plate. It's not a solid plate. It contains multiple openings, which we call foramina. Singular, foramen. If you're talking about just one, you have foramen. More than one, foramina. So they serve as passageways for cranial nerves, blood vessels like arteries and veins, as well as meningeal structures. So a fracture through a foramen can compress the nerves and vessels that pass through it, leading to a specific deficits like blindness, facial numbness, or hearing loss. So this is the base of the skull. We have the anterior cranial fossa, middle cranial fossa, and posterior cranial fossa. So we're going to be looking at these foraminas according to these cranial fossas. So the foraminas in the anterior cranial fossa, we have the cribriform plate foramen, which is located in the ethmoid bone and lateral to the crista galli. So if you look at it, this is the cribriform plate on the ethmoid bone, and this is our crista galli. So lateral to it, we have our cribriform plate foramen. So there are approximately 20 bundles of the olfactory nerves. So the olfactory nerves pass through this foramen. We have the anterior ethmoidal foramen, which is located in the frontoethmoidal suture and allows for passage of the anterior ethmoidal artery, nerve, and vein. Anterior ethmoidal artery, vein, and nerve. So we have the posterior ethmoidal foramen, which is located in the frontoethmoid suture between the frontal bone and the ethmoidal bone. So it allows for passage of the posterior ethmoidal vein, artery, and nerve. So like I said earlier, a severe head injury, for example a frontal impact, can shear the olfactory fibers, sorry for the noise, can shear the olfactory fibers against the cribriform plate, causing anosmia, which is loss of smell, and a potential CSF rhinorrhea, which is cerebrospinal fluid, CSF leaking through the nose. That's called CSF rhinorrhea. So any fracture to the frontal, or a frontal impact or a shear force to the base of the anterior cranial foramina, can cause any of these. So this is our anterior ethmoidal foramen, as you can see here, and this is our posterior ethmoidal foramen. As you can, this is anterior. If you see it anteriorly located, this is our posterior. So we now have the foramina in the middle cranial fossa, where we have the optic canal, which is not technically a foramen, but it is grouped here as a foramen. It's located in the lesser wing of the sphenoid bone, and the contents, we have the optic nerve as well as the ophthalmic artery, which is a branch of the internal carotid artery. So this space, it's only location where the meningeal sheath surrounds a nerve. Take note, the optic canal is the only space where a meningeal sheath surrounds a nerve. So optic nerve is an extension of the brain. Optic nerve is an extension of the brain. So we have the can see the optic canal here, and we have the optic nerve and ophthalmic artery. Moving to the superior orbital fissure. The superior orbital fissure is a cleft between the greater and the lesser wings of the sphenoid. Contents from superior to anterior. Contents of the superior orbital fissure from superior to anterior. We have the lacrimal nerve, the frontal nerve, the trochlear nerve, the oculomotor nerve, the nasociliary nerve, the abducens nerve, superior ophthalmic vein, and the sympathetic fibers from the carotid plexus. You have to memorize them in this order from superior to inferior. So this is the superior orbital fissure, and these are structures arranged from superior to inferior. So you take note of that. Now we look at foramen rotundum. Foramen rotundum, if you look at this image, we have our foramen rotundum here. See how where it's located, and if you look here, we have it here, foramen rotundum. So it's located in the greater wings of the sphenoid, inferior to the superior orbital fissure. Content, we have the maxillary nerve, which is the second branch of the fifth cranial nerve, which is purely sensory. We have the nasal, it supplies the nasal mucosa, the palate, the upper teeth, the cheek, the lower eyelids. They all receive innervation from the maxillary nerve through this foramen. Then we have the foramen ovale, which, if you look at this image, this is our foramen ovale. See, it's oval in shape. Then if you look at it here, this is it. This is our foramen ovale. Foramen ovale is located in the greater wing of the sphenoid, posterolateral to foramen rotundum. Look at this image. See, it is posterior to foramen rotundum and more laterally placed. So it is posterolateral to foramen rotundum. Content, we have the mandibular nerve, which is the third branch of the fifth cranial nerve, which is trigeminal nerve. It's a mixed nerve, unlike the maxillary nerve that is purely sensory. The mandibular nerve is a mixed nerve, has both motor and sensory innervation. We also have the accessory meningeal artery. It passes through this space. We have the lesser petrosal nerve, which occasionally passes through the foramen ovale. Occasionally passes through foramen ovale. And this serves as a landmark for the foramen ovale. Is an important landmark. Injected anesthetics are injected here and can use to block sensation from the lower face, anterior tongue, as well as the floor of the mouth during surgeries that involve the head and neck. So that's for foramen ovale. Now let's go to the foramen spinosum. Foramen spinosum, it is located posterolateral to foramen ovale. This is our foramen ovale. This is our foramen spinosum. So you see that it is located posterior and lateral to foramen ovale. Contents include the middle meningeal artery, the meningeal branch of the third branch of the fifth cranial nerve, that is the meningeal branch of the mandibular. Remember, we mentioned we have the mandibular nerve here, which is the third branch of the fifth cranial nerve. So the meningeal branch of that mandibular, to have the recurrent meningeal nerve, it passes through foramen spinosum. But most importantly, remember the middle meningeal artery, it passes there. It's important for epidural hematoma risk. If there's an injury to the medial meningeal artery, it could cause risk of epidural hematoma. So terion fracture, a fracture to the terion can tear the middle meningeal artery. Like I said, will lead to epidural hematoma. We have foramen lacerum. Foramen lacerum is located between the sphenoid, temporal, and occipital bones, medial to foramen ovale. It's located medial to foramen ovale. You can see it here. This is our foramen ovale, located medial to foramen ovale, posteromedial specifically to the foramen ovale. In the living, this foramen is filled with a cartilage called the basilar cartilage. The basilar cartilage. It is filled with a cartilage, so no major structure passes through it. So there's really no structure passing through foramen ovale. We have the hiatus, which is hiatus of facial canal, which contents include the greater petrosal nerve as well as the lesser petrosal nerve. The greater and lesser petrosal nerve passes through the hiatus of facial canal. Now let's look at foramina in the posterior cranial fossa. We have the internal acoustic meatus, which is located in the petrous part of the temporal bone. Petrous part of temporal bone. Contents include the facial nerve, the vestibulocochlear nerve, and the labyrinthine artery, a branch of the anterior internal carotid artery. So we have it. Note that at the fundus of the internal acoustic meatus, the facial nerve and the vestibulocochlear nerve separate into distinct canals. So there's a transverse crest that separates them. So this is our internal acoustic meatus. So we are saying that at the fundus of the internal acoustic meatus, its content, specifically the facial nerve and the vestibulocochlear nerve, separate into distinct canals. Yes. So we now have the jugular foramen, which is between the petrous part of the temporal bone and the occipital bones. Content, it contains structures that pass through it. We have the anteriorly, we have the inferior petrosal sinus, while the In the middle, we have glossopharyngeal nerve, vagus nerve, as well as the accessory nerve. Then posteriorly, we have the sigmoid sinus. Posteriorly, so the jugular foramen is divided into 3 parts. We have an anterior part, we have a middle part, and we have a posterior part. This is the jugular foramen, as you can see here, divided into 3 parts: anterior, middle, and posterior. Anteriorly, structures that pass through the anterior part is the inferior petrosal sinus. In the middle, we have the cranial nerves, which are the glossopharyngeal, vagus, and accessory nerves. Posteriorly, we have the sigmoid sinus, which becomes the internal jugular vein. So we have the hypoglossal canal. Hypoglossal canal, as we can see from this image, this is our hypoglossal canal located here. It's in the posterior cranial fossa, located within the occipital bone, superior to foramen magnum. This is our foramen magnum. It is superior to the foramen magnum. Contains the hypoglossal nerve, hypoglossal canal, hypoglossal nerve, which supplies the tongue muscles. So we have the foramen magnum, which is a large opening, as you can see from this image, a large opening in the occipital bone, deepest part of the posterior fossa. Content, it has the medulla oblongata, which becomes the spinal cord. We have the vertebral arteries, which enter to form the basilar artery. We have the anterior and posterior spinal arteries. We have spinal roots of cranial nerve 11, that's the accessory nerve. So these are the contents that passes through. They are also divided into anterior, middle, and posterior. Somebody should drop in the comment section. Whoever knows it should drop in the comment section the distribution of the content of the foramen magnum into anterior, middle, and posterior. I will be marking in the comment section. We now have the mastoid foramen, which is variable. Some sources say the mastoid foramen is part of the foramina in the posterior cranial fossa. Some sources eliminate or do not include it because it is located because it's located outside. But in this video, we are considering the foramen, the mastoid foramen, as a content of the posterior cranial fossa. It is located behind the mastoid process. If you look at this image, this is the mastoid foramen we have here. This is our mastoid process. Mastoid process. So posterior to the mastoid process, we have the mastoid foramen. Content, we have the emissary veins, which connect the sigmoid sinus to the posterior auricular vein. We also have the meningeal branch of the occipital artery. Emissary vein and meningeal branch of occipital artery pass through the mastoid foramen. Thank you for watching. That will be all for this video. Don't forget to subscribe to Alacrity Explains Anatomy for more videos. Like, share this video to friends and